demonstrate how to think like a nurse, we're going to use the clinical reasoning cycle to define a nursing problem. So first of all, we need to consider the patient. However, in this instance, we've only got Kate's case study to go on. We haven't met Kate in person, where we could actually pick up a lot more cues. So reading through Kate's story, there is actually a lot of information here, and there are many cues that we could consider. And we'll go over those more fully when we do our lectures. However, at the moment, our primary concern is ensuring Kate's safety. So for this exercise, we're purely going to focus on her airways. So in our case study, we know that Kate has a history of asthma. Now, as an experienced nurse, I know, and from personal experience, I know that asthma can be a life-threatening emergency. Now, because you don't have the knowledge or the experience at this stage, this is where you would be expected to go and look up further information on asthma. So at home yesterday, Kate had been using her inhaler more frequently to relieve symptoms. However, by late afternoon, it's not relieving her symptoms at all. So that tells us that her asthma at this stage is uncontrolled. When she came in by ambulance, she had a persistent cough that was getting worse, tightness in her chest, shortness of breath, and a progressively worsening wheeze. Again, this is confirmation that her asthma is uncontrolled. Also, with the pathophysiology with asthma, this also tells us that her airways would be inflamed, and she's probably got a bit of secretions happening as well as a result of that asthma. She's been given a provisional medical diagnosis of exacerbation of asthma. Now, don't confuse a medical diagnosis with a nursing diagnosis, as they're both very different. Overnight, Kate's condition has improved, although she still has respiratory distress. Her respiratory rate is elevated, and although her saturations are acceptable, she's still got nasal prongs on at 2 litres a minute, which tells us that at the moment she is unable to maintain her own airways. So given that at this stage she has uncontrollable asthma, her airways would be inflamed, she's probably got quite a few secretions as a result of that recent cold. Therefore, we would come up with a nursing diagnosis that Kate would have an ineffective breathing pattern.